Is exciting news for type 1 diabetes. Now this video is intended only for Indian audiences because that medicine is available in USA. I have an idea how to make that medicine available in India, and entire India should listen to it, not only the type 1 diabetic patients, because this idea is so groundbreaking, so simple, so easy to implement that it might change the medical landscape. Type 1 diabetes is rare, less than 10 lakh patients in India, and maybe 2 to 3 lakh patients will end up using this new medicine. Who cares about 2 to 3 lakh patients? We do. Means those are parents. We can tolerate if anything happens to us, but something happens to our kids. Still, in a country of 145 crore, but there is a selfish reason. And if you do something for selfish reason, your commitment is likely to be long term. Now, this is not medical advice. I'm not an endocrinologist, and I have nothing to do with this pharma company or the medication, teplizumab. It has been around for 4 years, but it got an exciting new indication 2 weeks ago. Let me first give my idea why India should listen to it, and then later I will go into the exciting science behind this that will be only for type 1 patients. So, a new medication comes, and then say like daraxonrasib, a patient of pancreatic cancer with KRAS mutation, they know it is available and they want to use it, but how can they do it? Then they start talking to people in USA and then ask the relatives to send it. Then you have to worry about customs, put it in their luggage, fill customs form. I mean, these patients already are a victim of biology. A disease happened. Let them not suffer from being a victim of geography also, because they are in India. Say like there is a rare disease and only couple 100,000 people are going to use that disease, and there is a brand new pharma medicine. Everybody wants India's consumer market. No, everybody wants India's market for products that can be mass produced, high turnover, low profit. But for specific, I'm not saying luxury in medicine, but for specific niche medicine that can only be used for few people, the pharma companies won't be interested. Guaranteed, they won't be. So who would be interested? Now India's committee is looking at it. Okay, means what are they studying? Such niche diseases, these trials have like 70 patients, 60 patients in USA. Where are the Indian trials going to come from? Who's going to do trials in India? Who's interested? So what should we do there? My idea is simple. Give at risk permission to any medicine that is approved in US. Are we surrendering our sovereignty? Just let's not make any ridiculous argument, right? So all that Indian government is doing without any risk to itself, FDA has already done it. 3, 4, 5, 6 years goes into it. They give at risk approval. That removes the supererogatory burden, the administrative burden of like filling forms, customs, legal problems from the patients and their relatives. They obtain it, they take it at their risk. If something happens, it's the patient's responsibility. And if India can do a post-marketing registry, so we get to study, have an Indian trial at no risk to ourselves. They said, oh, so are you using Indians as guinea pigs? No, nobody is using anybody. This product is already approved, any such product in USA. You just give it a at-risk approval. Government has nothing to do with it. And for niche diseases, for rare diseases, who's going to be interested in Indians? Indian government, right? So they can strike a deal with a pharma company that will give you at-risk approval. Rich patients can import it through their doctor without any burden or problem. And against that, you give us 20,000 doses that can be used in government centers to be used for poor or middle class people. Middle class people are technically poor when such high expense medication comes. And so there is a medication coming for type 1 diabetes called Vertex. It will come in few months. They had 2 products and they gave up on the second one because it was not very effective. My thinking is that product can come back and it will work wonders for type 2. I'm just politely saying I think. I'm pretty sure. If I think so, it will happen. Confident. So that can benefit crores of patients. So that's why India should care. And never send, no man is an island, entire of itself. For never send to know for whom the bell toll, it tolls for thee. So that's why we should care about it. Now I'm done with why India should care portion. Now let's go into type 1. What is this teplizumab? Pancreas is a factory where there are say 100 workers, and all workers wear a cap, and that cap is called C-peptide. So a worker is present when the cap C-peptide is there. Cap is not there, worker is not there. Worker is there, C-peptide is there. In type 2 diabetes, which is very common, that 100 workers in the pancreatic factory become lazy. They don't do any work. So glucose accumulates. That accumulated glucose goes into the urine. It is like a marshmallow. It's hygroscopic. It sucks water. That's why you feel dehydrated. You feel very thirsty. You feel very hungry, and you have to urinate often. Those are the signs of diabetes. In type 1 diabetes, somebody comes, the autoimmunity, and those antibodies destroy those 100 workers. All of them die. How do we know they are died? Because their caps, C-peptide level becomes 0, undetectable. But, so what is the treatment? There is no treatment. You have to import the workers from outside, exogenous insulin, lot of side effects. So, at times, the autoimmunity has 3 stages. First stage is very difficult to detect in India. Second stage, where maybe out of 100, 70 or 80 workers will die. The 20 are remaining. We know that by checking the C-peptide level. We can protect those 20 workers, and they keep going for 4 or 5 years. And now the same thing can happen in somebody who is symptomatic, diagnosed with type 1 diabetes, a young child, and if the C-peptide level is there, that means some workers, some insulin producing beta molecules are there, and we can extend their life by 4 years. You said 4 years, big deal. After 4 years, they are going to end up on insulin. No, there are 2 benefits. If you have an 8-year-old child, imagine the bliss that the child will have for 4 years, not to deal with the needles and the sugar checks and the complications of diabetes. And if we give that child 4 years, guaranteed we are going to come with a cure for type 1 diabetes in next 4 years. So the child may never suffer any of these side effects. So that is stage 3 of type 1 diabetes. So this is, I was hoping that this medication is simple, just taken by mouth, but no, it has to be taken by vein, intravenous. You have to go to the hospital for 2 weeks, and there are some side effects. And obviously, if it comes in India, then there are going to be WhatsApp stories which are like very anti-science. But we have to deal with all that. So that's the product, teplizumab. I have nothing to do with it. Now, you say, but Indian committee will think about it. Yeah, but to prevent stage 2 or to delay stage 2 by 4 to 5 years, the approval in US was given in November 2022. That was 4 years ago. So the type 1 diabetics who are sitting in India could have used this medication. It's not easy to use, but it is available. So I think in terms of science, we have to take this step. And Indian government can create a department. It's very simple. It can be done very easily. That will work with all these pharmaceutical companies, try and give at-risk approval to some products, do post-market research, get some free doses, and if they understand the molecule, make an offer to make a niche medication at lower cost for rest of the world. That could be India's role. Dr. Ravi Godse. Sorry for the long video.